Aloha and welcome to Live at the Legislature. I'm Jill Kuramoto. Every week we sit down with Hawaii State Senators to talk about the issues and the events that are happening within the Senate during this legislative session. This morning we are joined by Senator Josh Green. Senator Green represents District 3, Kona to Ka'u. He's also the chair of the Senate Committee on Human Services. And we also have Senator Stanley Chang. Senator Chang represents District 9, Hawaii Kai to Diamond Head. He is the vice chair for the Senate Committee on Human Services. Good morning to both of you. Thank you for joining us. Let's get right into this. And I know that there's an overriding theme that your committee has been operating under. Let's talk about that briefly.
So the committee itself is meant to try to help people who are struggling. And that's what Human Services is all about. We've been focused this year and in the recent past on homelessness, child advocacy, and our kapuna. So these are where a lot of the bills come from. You add something, Stan?
Yeah, and I think out of all of those, it's fair to say that homelessness is the #1 issue that we get complaints about, emails, questions, and that's really the core of what my focus has been on the committee.
Great. Well, let's talk about that. There are a number of issues that I know that you've heard during your committee during the session, and the statewide homeless initiative is just one of those. But there's many other bills. Let's talk briefly about what we've done so far.
Sure. Well, to frame the issue very briefly, we know that there are between 8,000 and 12,000 individuals in Hawaii that are homeless, the highest per capita rate in the nation. And we appreciate what the governor has been working on, but we've, at the legislative level, felt that there had to be additional priorities. So some of the bills are meant to prevent people from becoming homeless. I will give you the number, Senate Bill 2027, the CSHI program. That's resources when people are tipping into homelessness that we can finance a little bit of rent to keep them from going in. Incredible results when this program was up and running with Aloha United Way. They were able to keep 1,400 households from falling into homelessness. So we look at things like that. We feel you have to have a lot of arrows in your quiver to deal with homelessness. And that's one of the many ways we're approaching it.
Another big issue that we're working on is the issue of safe zones.
Yes.
The governor has promised to bring homelessness to functional zero by 2020. Unfortunately, existing initiatives like Housing First only cover 100, 200 people, and out of 7,000, 8,000, over 10,000 people, it's just not enough. So we were able to pass a bill through the Senate this year to create safe zones with modular housing, security, services, treatment, and other necessary features to make it a functioning community. And hopefully that can be part of the solution as well.
I so agree with Senator Chang, because his perspective is you have to have this broad solution, because when you talk to the governor's team, they only can handle smaller pieces of it at a time. And that's no fault. We're not applying fault or blame. We're saying that some people won't avail themselves immediately of services, or we don't have the units. So we don't want tent cities. That's not at all what we're talking about. We're talking about safe zones that some people are calling them Ohana zones. The point is that I've gone to the camps on many occasions and actually volunteered, delivered healthcare in person, and I see some people simply aren't ready yet to go into permanent housing, and the housing itself is not ready. So we need to pass this kind of legislation. We put a 10-year sunset on it to give it a 10-year approach, a scope in the committee. So we're trying to be cooperative with the governor's office, but we know there can't be just one simple fix.
Absolutely. Okay, well, let's go on. Healthcare premiums, we know, have increased dramatically across the state. Recent statistics show that healthcare costs account for 14% of a resident's income. How is the Senate addressing affordable healthcare?
Boy, that's a gigantic question. We could spend 10 hours on this question. So at the Senate level, one thing that we've done is we've always been extremely supportive, as has the House, with our Medicaid program. Our Medicaid premiums, well, our Medicaid program, just so people understand, covers now as many as 362,000 individuals in our state. That's 1 out of every 4 individuals in our state. And we do that because if someone has no health insurance at all, and they have a crisis and they see me as their ER doc, they will go bankrupt. It's just a tragedy, and if you have surgical needs or you have an accident, there's no way any of us can afford, except for the tiniest little percentage of rich people probably, afford to be uninsured. So we're always trying to support the system. But we also believe that there's got to be a lot of support for the insurance system unto itself. So we need subsidies to some degree, once again, because you're either going to pay now or you're going to pay later. And if someone goes bankrupt and then becomes homeless, it's going to be a lot more expensive, it's going to be tragic for their family, and no one benefits.
Exactly.
I think one of the really important things to realize is that homelessness is a very, very expensive burden on our healthcare system. And in fact, a gentleman who recently passed away was the #1 user of emergency services. He was a homeless gentleman, and he cost the state taxpayers $2 million in just 1 year. So if we're able to deliver those services where people are when they need them, instead of having them come constantly cycling through the ER and through the hospitals, which has to be just about the most expensive type of care we have in America, that will save the taxpayers a lot of money.
Yeah, I should even elaborate on that. So we spend the budget that Stanley and I work on for the Human Services Committee, the Human Services Department in Hawaii. That's a $3.6 billion budget. It's the largest budget of any department in the state. $2 billion of that, $2 billion, comes out of the Medicaid plan, which is our safety nets, 1 out of every 6 taxpayer dollars. But just 3.6% of the individuals on Medicaid, 13,000 people in Hawaii, consume 61% of those Medicaid dollars. That's $1.2 billion. So what Stan is talking about is right on. We need to have a better system where we put a roof over someone's head, their costs drop 43%. One study just showed 73% drop in costs. All those resources can then be used for building housing, they could be used for pre-K education, they could be used for child protective services, and any other services that you can imagine we would be able to afford.
Absolutely. So a lot of these issues are intertwined.
Yes.
Real briefly, we have less than a minute, less than 2 minutes here, but caring for our children and our seniors, there's been a number of important measures that have addressed child welfare. Let's talk about that real briefly, especially child welfare services. I know which made headlines recently. There's a pilot program that that's an initiative this session.
Yeah, my Big Island colleagues and I are fighting to do a pilot on the Big Island where they've had a severe drop in the amount of service professionals, yet they have 3 times the number of cases in East Hawaii of children that need to be protected. We've even had some of those catastrophic cases where children have died, and we've read about that in the newspaper. We'd like to see if you could have enough service where the social workers don't have to have 50, 70, 80 children to look after, a smaller number. If not only will we protect children, but again, we will protect the state resource. Because once a child is tragically hurt or goes into foster care, a lot of times it's hard to recover from that.
Absolutely. I know there's been so many other issues that we could definitely talk about.
Want to touch on kapuna
we have
care real fast?
20 seconds.
Well, the Senate is really pushing $3.4 million for kapuna care to help working families take care of their kapuna who need it. And that's going to be the first of its kind in the nation. We're going to help the caregivers for our elderly.
Absolutely. Okay, we hope so. All right, thank you so much for joining us this morning, and thank you for watching Live at the Legislature. We'll be seeing you next week.